Lydia E. Hall, The Care, the Cure, the Core Nursing Theory. She was an innovator, motivator, and mentor to all nurses in all phases of their nursing career. Her experience has given her insight on distinct roles of nursing and providing care for patients and how nurses can be of utmost importance in caring for patients. She was an advocate for the chronically ill patient. I introduce to you Lydia E. Hall. Lydia Eloise Hall was born September the 21st, 1906 in New York City. She grew up in Pennsylvania. She graduated at York Hospital School of Nursing in 1927. She received her bachelor's degree in public health nursing in 1932. She earned her master's degree in 1942 at the Teachers College, Columbia University. She promoted involvement of the community in healthcare issues. Lydia used her philosophy of nursing to establish the Loeb Center for Nursing at the Montefiore Hospital in Bronx, New York. This was an 80-bed capacity center. She served as the administrative director for the Loeb Center from 1963 to 1969. She published over 20 articles about the Loeb Center and her theories in long-term care and chronic disease control. A study in 1975 of the Loeb Center revealed that those admitted to the nursing unit, when compared to those admitted to traditional nursing units, they were admitted less often, they recovered in half the time and less than half the cost, they were more independent, they had a higher post-discharge quality of life, and were more satisfied with their hospital stay and the nursing care that they received at the Loeb Center. The core, the care, and the cure theory was developed in the late 1960s. Lydia postulated that individuals could be conceptualized in three separate domains: the body, which is the care, the illness, which is the cure, and the person, which is the core. The core's sole function was of the nurse, being the nurturer, the provider, and the caregiver. The care and the cure shared roles with other members of the healthcare providers. This includes your doctors, your social workers, your therapists, and so forth. Those roles were shared between those other members of the healthcare team. She believed that patients should only receive care from professional nurses. She also believed that nursing involved interacting with patients in a complex process of teaching and learning. It was an ongoing learning and teaching process, something that started from admission and continued until discharge and sometimes even after discharge. She envisioned each of the overlapping circles as an aspect of the nursing process related to the patient, to the supporting sciences, and to the underlying philosophical dynamics. The circles overlap and change in size as the patient progresses through a medical crisis to the rehabilitative phase of their illness. The care phase, which is the body phase, which again represents the nurses, is the predominant circle. This part of the model focuses on the nurses performing the noble task of nurturing the patient. This component is the motherly care provided by the nurses. which may include provisions of comfort measures, provisions for patient teaching, assisting patients to meet their needs where help is needed. This aspect of the model provides the opportunity for closeness and allows you to see the process as an interpersonal relationship between the nurse and the patient. The hands-on patient care provides an environment of comfort and trust and promotes open communication between the nurses and the patient. The major purpose of the care is to achieve that interpersonal relationship with the patient so that the patient may open up to you and discuss their own personal concerns and feelings about their care. You want the patient to be active in their nursing treatment as well as know anything and everything that they wish to know about what is going on in their disease process. Another focus of the care phase is to facilitate the development of the core phase. The cure phase, which is the illness phase, this phase is shared with medicine. This phase is also shared with your physicians and the other members of your healthcare team as well. The nurse applies medical knowledge to treatment of the person. Hall has two ways the medical aspect may be viewed. It may be viewed as the nurse just assisting the doctor by assuming medical tasks or functions. This can include the nurse doing dressing changes, any types of treatment, administering medications to the patient, all under the doctor's care. The other view is to see that the nurse assisting the patient through his or her medical or surgical procedure and rehabilitative care in the role of the comforter and the nurturer. So it goes back to being that comforting and nurturing spirit for the patient during their time of need. For example, if they're going into surgery, you want to be there to comfort them and console them and just be that listening ear for them so that they may voice their concerns about what is about to take place and answer some questions that they might not be sure of. The core phase, which is the person. This area emphasizes in the social, emotional, spiritual, and intellectual needs of the patient in relation to the family, institution, community, and the world. Knowledge foundational to the core was based on the social sciences and the therapeutic use of self. Through the closeness offered by the provisions of the intimate bodily care, the patient will feel comfortable enough to explore with the nurse who he or she is, where he or she is, where he or she wants to go in the future, and will take or refuse help in getting there. The patient will make amazingly rapid progress towards recovery and rehabilitation. Hall believes that through this process, the patient will emerge as a whole person. This allows the patient to receive total care and they have total commitment from everyone in the nursing field to assure they are getting the best care possible. That is through collaboration through the teams, that is through patient teaching, that is through being that listening ear, that is through being that nurturing force as a nurse to provide them with any and every need that they have throughout the duration of their stay in your facility. Lydia Hall, she was that listening force. Those that knew her loved her. Her saying is this: to care is to nurse, and to nurse is to give yourself when you care. Thank you for listening.